Good morning, everyone. I'm Dr. Steve Stites, and today we're bringing you a special Encore presentation of one of my absolute favorite episodes. Right now, our team is working hard behind the scenes to bring you more incredible stories when our live program returns in September. And if there's an urgent health update, we'll be here to bring it to you first. But for now, sit back and enjoy this Encore presentation. And remember, faith, hope, and science.
Good morning. I'm Dr. Sean Coomer, Chief Medical Officer of the Kansas City Division of the University of Kansas Health System. I'm filling in for Dr. Steve Stites on this edition of Open Mics with Dr. Stites/Coomer. For athletes, their health and fitness is everything, which is why an injury can be devastating, especially for young athletes who worry about their high school, college, and even professional careers. Today we're learning how the keen eye and quick actions of an athletic trainer help keep one local athlete out of the operating room. I want to welcome Logan Misbagel. She is a senior at Olathe East and a varsity soccer and basketball player. She'll tell us about a recent injury in just a moment. Also at the desk with me is athletic trainer Aaron Washington and Dr. Thomas Katzvai, a family and sports medicine physician. Joining us virtually is Dr. Brian Vopat, an orthopedic surgeon with the health system. But as we're about to learn, Logan didn't need to see Dr. Vopat for surgery. Logan, your season got off to a rough start this year. Can you tell us what happened?
Yeah, of course. So last season, about 2 games in, I was at practice dribbling the ball like any other day, and then my foot got caught on the grass and it popped, and then I instantly felt pain, and then I was done with practice, and then the next day I couldn't walk on it, so I went and saw Aaron, my athletic trainer. So yeah.
Okay. So what was the mechanism? It got caught, you said. Did the toe get caught? Or the whole...
almost like rolled forward, like if this was the top of my foot, it rolled, and then it popped. So I wasn't sure at first what it was because I've had ankle injuries before, so I was like, it's not my ankle, but don't know what it is. So.
Gotcha. Okay, and I think that's a common mechanism. We'll talk about that a little bit later. The next day you were able to go down the hall at Olathe East and see your athletic trainer, Aaron. Aaron, you're with the University of Kansas Health System, but you work on site at area high schools, which is a fantastic program here at the health system. Did you already know Logan before this happened?
I did. Logan has seen me multiple times for, like she said, ankle stuff, and she's not afraid of getting bruises and seeing me for those things too, because she's a hard-nosed player. But she was having that relationship beforehand, before having her with the significant injury helped, because she knew she could trust me and come and see me.
That's fantastic. So you knew pretty quickly what kind of injury that Logan had. How did you know that?
You know, that's just with our training, with athletic training. We're educated in all the different injuries that can happen with sports. And so even though this is an injury that we don't see very often, we know it's a potential, and we want to be able to recognize it right away to reduce further harm.
This injury is called a Lisfranc injury, and it's apparently named after a French physician in Napoleon's army, so I guess it's been around for a while. So I'm going to turn now to Dr. Brian Vopat. Dr. Vopat, can you tell us a little bit more about a Lisfranc injury? And I understand it can be easily misdiagnosed.
Yeah, it's a very common one to be misdiagnosed. And another point there is there's actually an OB-GYN doctor in Napoleon army that named it. But what happens is you injure the midfoot. It's like it can be a midfoot sprain to a injury that actually needs surgery, and it can be very subtle findings, and you have to be very careful when you're looking at it. And then you have to get X-rays, and then even on X-rays, it can be easily missed. The old literature used to show these can be missed 35% of the time, and a high litigation for the emergency room, just because it's something that you have to know that is a possibility to make sure you diagnose it correctly.
You hinted at it, but how commonly do you see this?
Well, in my practice, I tend to see it fairly commonly, but that's just because of the way my practice is. But in our athletes, you see it probably like 2% of the time. We looked at an NFL study where we looked the last 7 years of the combine, and I think we had 45 patients that had them. So they do happen. It's not completely very common injury, but something that you don't want to miss because it can cause something that have morbidity for your athlete or your normal person if we don't treat it appropriately.
Okay, and and Dr. Vopat said he sees it a lot. He does specialize in foot and ankle surgery within orthopedic surgery, so I imagine you see it plenty. So is surgery normally recommended?
It depends the injury. So there's two different types. One's a stable injury and one's an unstable injury, and that's why you have to probably look at it with X-ray. And here at the health system, we have something called a weight-bearing CT scan if we are a little bit concerned about it. We're the only ones in the region that have that, and that can also help better differentiate whether it's stable or unstable. If it's a stable injury, like Logan had, unfortunately, we can treat these non-operatively. However, we have to make sure that's not unstable, because those are the ones that need to be fixed and can cause long-term issues if it's not treated appropriately.
So what is the biggest reason that Logan didn't need surgery?
And luckily, she had a stable injury. And then the big thing there is to let it calm down so it isn't something that continues to linger. So by them identifying it early on, we're able to allow it to put her in a boot, rest it, allow it to calm down, heal appropriately, so then she could get back to her activities faster that way.
Okay. We're going to hear in a few minutes about her non-operative recovery, but had she needed surgery, what kind of recovery would be needed there?
It's usually, we call it it's a year-ending injury in the sports in NFL or in basketball. It's a 6-month recovery. Usually, you have to put hardware in, and then about 5 months later, you usually take that hardware out. But it's usually at least a 6-month recovery time. So if someone injured it during the season, they're usually out for the season for that year.
So without that quick intervention, it could have been a lot worse.
It could have, and luckily her injury was the type that didn't need an intervention. So it was kind of a combination. One, they treated it very appropriately. Two, her injury was more of a stable injury. So and then identifying that it was stable, we could treat it appropriately so that she could recover quicker.
Right. So Dr. Vopat, I know you're on a tight schedule. You've got your uniform on to head to the OR. And you start in a few minutes. So before we let you go, we thank you for being here, making time. Do you have any final thoughts before you head into the OR?
No, I think it's very important, like, well, you have people that know what to look for. Like Aaron identified it and sent to Tom, who identified that was a Lisfranc very appropriately. And then we make a decision whether it's something that could be treated non-operatively versus operatively. So I think what they did was completely what we're hoping that most people are able to do throughout the community. But I think they did an amazing job, and they allowed her to get back as quick as she could.
Great. Well, Dr. Vopat, thanks for being here. Really appreciate it. Good luck in the OR this morning.
Thank you.
Logan was also in the care of Dr. Katzfei. Doctor, we have images of Logan's injury. What are we looking at here?
Yeah, so here we've got an MRI of her foot, and what's been circled there is the area of the Lisfranc ligament itself, where we can see a partial rupturing. And what you can see on the left side of that screen is the inside part of her foot. Just to the top left of that circle is her first metatarsal, the first bone within her first toe, and then just inferior to that, or just below that one, is the medial cuneiform. So what you see with the Lisfranc is the medial cuneiform attaches to the second metatarsal, and so that's where this ligament connects, and we see the rupture there. But at the bottom left of that medial cuneiform bone, just to the bottom left of that circle, you can see some whiteness that's there. There's some bony edema, which is at the medial aspect of the medial cuneiform, and that's due to the direct impact of the type of injury that she had sustained. The thing we see here that's actually reassuring, Dr. Vopat kind of alluded to it as well, is we don't see a major separation between the first and second metatarsal, which is good because that would be indicative of a more stable type of an injury.
Okay. So with surgery ruled out, can you take us through your evaluation of Logan's injury and what you recommend for treatment?
Absolutely, and Dr. Vopat alluded to it. So the first thing is that it was identified very quickly by Erin, and she knew that this was something significant. So getting Logan immobilized in a cam boot is the absolute first thing that we want to do. Mm-hmm. We need to protect these types of injuries so that they don't progress and potentially worsen. And so she was in the boot for approximately 6-ish weeks, and then based on reevaluation, and as long as things are not regressing, her pain's not getting any worse, we look to transition her out of the cam boot and get her into a carbon fiber insole. At that time, we also start physical therapy, because what we really want to do is get these athletes back as quickly as possible. So we need to strengthen that lower extremity. We want to work on her range of motion and make sure that we don't develop any stiffness, which is pretty common when you're immobilized for so long. It also allows her to get back to sports-specific training so she can get back to sports as quickly as possible, in basketball in her case.
All right. Yeah. So we heard from Dr. Vopat that 6 months, season ending. You just mentioned 6 weeks. So that's so after that 6 weeks, and I want to hear a little bit more, but how long does this injury take to heal beyond the 6 weeks?
Yeah, I'd say about 8 weeks tends to be fairly typical. Now that's just for the injury itself to heal. But now when we deal with athletes, we also need to get them back in a safe manner. So after that initial about 8 weeks, then we're getting into physical therapy. We can certainly tack on a few more weeks too as well. And so that can fluctuate depending on how the athletes will respond. So that timeline is roughly appropriate what we would expect.
So we're going to get to Logan here. Thanks for listening to everybody talk about you and your injury. Really appreciate it. How's recovery going?
It's going great. Well, back when I got injured, I was in a boot for a while, as he was saying, and then I got transferred into that carbon insole. Then after that, I went to physical therapy with this beautiful lady named Renee. She's amazing. I love her. But we worked on a lot of stuff really with planting, because that was important, especially with basketball. In soccer, you have to be quick and move back and forth a lot. So that was important. And then now I'm moving into playing, and basketball season is coming up. So now it's just being consistent with still doing my workouts so I don't get re-injured. So
pretty excited to start playing basketball then.
Very.
All right, with a functioning foot.
Yeah, yeah, that'd be great.
Dr. Katzfei, can you, when do you think she'll be able to get back to full participation? Probably not in soccer, but basketball. Basketball season starts in 4 weeks for her.
Yeah, no, great question. And I expect her to be fully participating at this point, given the injury she sustained was back in March. So we've had plenty of time from recovery, and from everything I've gathered, also from the physical therapist, she's gotten the green light and she's ready to go.
All right, fantastic. So Erin, Logan spent a lot of time in physical therapy. We have a video of her working out here. What kinds of exercises is she doing, and how are they helping her?
She's doing a lot of hand-eye coordination and focusing on that foot agility. So a lot of her injury is right at the arch in her foot, and it needs to be able to be stable to absorb those loads with the full body weight and onto your toes. So she was doing the agility ladder, and then those pods are reaction lights. So she has to go and tap them, and she gets timed. It's really neat. It's a Bluetooth type of application that the physical therapist has on her phone to see how she's improved, and then she has to quickly react and change direction, which is all really good for her and her foot to get better. And this is one of her last days of physical therapy, so she's at her max and just kind of testing out on this day, so she did great.
So as a physical therapist, how do you know that maybe she's not progressing? Is it pain for her, or is it something you see?
Well, for physical therapy, I'm sure the physical therapist would look at her function, her pain. They always take a pain intake, and her function compared to her good side, her bilateral side. That's definitely what they would look for.
So Logan, have you been able to start working with your soccer and basketball teams yet?
I have. So over the summer we had some camps, and I was able to participate in that. At that point I wasn't cleared for everything, but most things. But now I'm into weights for getting ready for basketball. So yeah.
And your mom's here. She probably held you back a little bit, to make sure you weren't overdoing it, right?
Yeah, she really wanted to make sure I wasn't overdoing it.
Okay. So it must have been great to start this whole process with an athletic trainer that you saw right down the hall and you've known for some time. How are you feeling now compared to when you first got hurt?
Much better. When I first got hurt, couldn't even walk on it. Was instant pain. Erin realized that. Obviously, I'm not really a person to complain about pain, I feel like. So, and she knows me personally, and I trust Erin, which is why I was able to go to her so easily.
So you told us that you're grateful Erin wasn't there just for your physical health, but also your mental health and well-being as well. Can you tell us a little bit more about that?
Yeah, of course. I think as an athlete, getting injured, sometimes it's overlooked for your mental health, because watching everybody being healthy and playing like a sport that you've played your whole life, that you love, can be a little mentally straining. So Erin always being there just for a friend. I know right when I got hurt, she was like, I'm always here just if you want to come hang out with me. But yeah, just having her to talk to and tell somebody about what you're going through is great. Yeah.
So Erin, why is it such a big advantage to have an athletic trainer that's always on site for games and practices?
Just to be able to not only just know them before they're injured, but know that they can come and see me for those injuries and address it right in the beginning, so that they're not just kind of limping around and saying, "Oh, I just hurt my arch, not a big deal," or it's just a knee issue. We're fine. We'll get through it. And then 2 weeks later, we need to really address it. We were able to start with her from the beginning for the very next day and get it immobilized and protected so that it had a good healing outcome.
So I'm a surgeon. I'd like to see a problem and fix it, and it's pretty quick. And this took a little bit more time. So it's got to be pretty exciting to see Logan's progress through all this over the months, really.
Yeah, it is, and it's fun to see that her sports season's coming up, and we'll get to see her fully. And that's the best part of being an athletic trainer, being in the high school with them, is not only do I get to know them beforehand, get to help them with their injury during, but get to see the successful outcome. So that's pretty unique that not every profession provides.
Yeah, I'm sure you're going to have a few people at that first game for you, the basketball game. So we're here to answer your questions. Send them using the links on your screen, YouTube, Facebook, or email the Medical News Network. So we know many of you have questions out there. Let's head to Studio B with ADC. Alexis?
All right, Amy has a great question. Amy wants to know, has Erin ever seen an injury like Logan's before in her career?
Not to this extent. I've seen it as a student when I was doing rotations in college settings. I had one other student with the Lisfranc injury as well, but not often. She's really my second, and she's definitely probably the worser one of the injuries that we've seen.
Lucky Logan. Ruth Allen has a great question. Ruth wants to know, how important is the type of shoe an athlete wears for specific sports in order to protect the ankle or the foot?
Dr. Katzvai, you want to take that one?
You know, it's a great question. I don't think there's really necessarily a uniform answer. And so I think the big thing that we try to encourage for our athletes and have our conversations with athletic trainers is really good prevention and proper preparation. So that means, you know, early conditioning prior to athletic seasons, and making sure people are doing a lot of injury prevention work with their athletic trainers, or if we ever have to get physical therapists involved. And so we see a significant reduction in injuries when we have the right preparation going into sports seasons.
Jeremy Yenser has a question. Jeremy wants to know, how can you tell when an injury for an athlete is ready to be able to withstand the intensity of just how physical athletes are?
Yeah, again, it's a great question, and that's one that it's a tricky one to answer sometimes because it's very dependent on the patient or the athlete themselves. And so this progress is monitored a lot through the physical therapy teams and colleagues that we work with. And what we eventually get to is a stage where we have a return to sport testing. And so that really puts them through a rigorous sport-specific exercises and movements to ensure that it is fully safe for them to participate, which Logan did a great job and she passed with flying colors.
Denise has a question, and I'll send this one to Erin. Denise wants to know, when it comes to athletic trainers, what do you do at the schools when you're not seeing an athlete for treatment or you're not standing on the sidelines of a game?
A lot of times we are preparing for those situations. So we're preparing our treatment plans, our who we're seeing that day, talking with coaches, talking with our school nurses, our admin team, and documenting all of our interactions between the athletes throughout the day. So documenting those injuries and the treatments that we provided.
I have a question for Erin. Teenagers are just notorious for playing through injuries. I mean, my son had a broken ankle and he just kept going because he didn't want to stop whatever he was doing. Do you have a specific eye? Are you kind of trained to see when you know a student shouldn't be out there, shouldn't be playing, because you can tell that they have an injury?
Yeah, and I think that comes from knowing them too. So knowing their typical mannerisms, knowing how they get up from a play, if they're quickly the first one up after landing on the ground, but this time they're slow to get up or they're really slunken. So some of those key things that we look for with their mannerisms, I hone in to and check on them when they come off to the side and see what's going on. And I think it's also just really important, the culture with our sports teams, that it's safe to be able to report injuries, and that comes from good supporting coaching staff that we have at Olathe East, and a lot of our schools do. We have that supportive role to be able to report those injuries so they feel safe to do so.
Well, this has been a great discussion. I'm grateful to our guests for being here. I also want to get final thoughts from everyone. So, Erin, I'll kick it to you first.
Oh, I think this was a successful outcome for Logan, and it went through all the right channels within our own health system, which was huge. And we were able to use aspects from the recent merger as well with the Latham Medical and University of Kansas Health System, with getting Logan into the right doctor to make sure we get her seen and having that diagnosis, and having her referred to our foot and ankle specialist with the University of Kansas Health System, and having a great outcome with physical therapy is going to be her key to successful return. So she had a great recovery with the whole team, and that's what it's about.
Logan, what are your thoughts?
Yeah, I just have to thank Erin and all of my doctors for immediately knowing what it is, because I know that they were saying that it's not usually identified sometimes, and I'm glad I'm getting back to play. So, yeah.
All right. Well, fantastic. You've done a great job. Thanks for being here. Dr. Katzwey?
I just re-echo what Erin said, and I think one of the biggest things for anybody listening is, if there's ever a question or a doubt about an injury or a concern, have that conversation with your athletic trainer. Come in and be evaluated. I know a lot of times there's some hesitation about being forced to sit out, but like in her case, when we catch things early, we can really work on getting people back to their sport or whatever activity they like to do a lot faster. So open up and let us know.
Well, my final thoughts are really, there's a lot of support out there. We're seeing a great example here of an athletic trainer embedded into a high school, working with student athletes and a couple of physicians, a surgeon, and also a sports medicine non-operative specialist that worked together to get this athlete back in the field, and no doubt helped her mental well-being beyond what happened with her Lisfranc injury. So there's opportunities out there, so please look for them and don't hesitate to reach out. Don't be afraid.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now everywhere podcasts are available.